Tobacco products include cigarettes, smokeless tobacco, also known as chewing tobacco, and snuff, cigars, or pipe tobacco. When did you last smoke?
12 hours ago.
The carbon monoxide level in your blood drops to normal.
2 weeks to 3 months ago.
Your chance of having a heart attack begins to drop, and lung function begins to improve.
1 to 9 months ago.
The coughing and shortness of breath you've been experiencing decrease.
1 year ago.
Your added risk of coronary heart disease because of smoking has been cut in half.
2 to 5 years ago.
Your chance of having a stroke is reduced to the same as a non-smoker.
10 years ago.
Your chance of dying from lung cancer is just half of what it was when you smoked. Also, your risk of getting cancers of the mouth, throat, esophagus, bladder, kidney, and pancreas has dropped.
15 years ago.
Your risk of coronary heart disease is reduced to that of a non-smoker's.
Why is it important to stop smoking?
Many people in recovery from other addictions smoke tobacco. However, smoking can be more harmful than you think. It causes more deaths than illnesses related to other addictions. Quitting smoking improves the chances of long-term recovery. Counseling and medication can help you quit smoking for good.
I feel alone.
You are not alone. 80% of people on methadone maintenance, for instance, use tobacco.
What are the health effects of tobacco use?
The detrimental effects of tobacco use are well documented. From 2000 to 2004, cigarette smoking and exposure to secondhand smoke resulted in at least 443,000 premature deaths each year and $96.8 billion in productivity losses annually in the United States. From 2001 to 2004, smoking-related healthcare costs were $96 billion annually. Tobacco use is the leading cause of preventable disease and deaths in the United States. It can cause diseases of the lungs and cardiovascular system as well as many cancers.
Come on, let's be realistic. Quitting is very hard. What should I expect? Can I really quit?
Yes, you can. You may receive individual, group, or telephone-based sessions to help you quit smoking. You will learn about how tobacco affects your health and tips to help you quit. Then, you and your counselor and doctor will help you come up with a plan. Here are some examples of what you might talk about. 1. Your reasons for quitting. Is it to get healthy, for your children, or to save money? 2. Your goals. Your counselor and support group can help you set goals to quit smoking. Then, they will help you with each step. 3. Your treatment plan. Your counselor will help you come up with a plan that works for you. The plan could include medications to help you quit, counseling, or both.
Are there any symptoms of nicotine withdrawal?
Nicotine withdrawal symptoms are similar to those of other substances and to the symptoms of some behavioral health disorders. Some symptoms include 1. An intense craving for nicotine. 2. Tension, irritability, frustration. 3. Mild depression, reduced ability to experience pleasure, and hedonia, dysphoria. 4. Anxiety. 5. Anger. 6. Restlessness, difficulty concentrating. 7. Increased appetite. Acute physiological nicotine-related withdrawal symptoms usually peak 24 to 48 hours after a person quits, and they diminish within a matter of weeks. The physiological cravings for nicotine usually last about 7 days, but several different smoking cessation medications that can help you quit. Taking these medications and finishing the program make quitting easier. 3. You could save thousands of dollars each year by quitting smoking. 4. Quitting heals your body and your mind. Studies show that your mood will improve and your anxiety can lessen.
What are the health benefits of tobacco use cessation?
The most important effects of tobacco use cessation are the immediate and long-term beneficial health changes. 1. Cigarette smoking accelerates age-related decline in lung function. However, with sustained abstinence from smoking, the rate of decline in pulmonary function returns to that of people who never smoked. 2. Smoking cessation reduces rates of cough, productive cough, and wheezing, as well as respiratory infections such as bronchitis and pneumonia, compared with rates among people who continued smoking. 3. After 1 year, the risk of coronary heart disease, CHD, is half of that of a person who smokes. After 15 years of abstinence, risk of CHD is similar to that of persons who have never smoked. 4. After several years, stroke risk is reduced to that of a person who has never smoked. 5. After 10 years of abstinence, the lung cancer death rate is about 30 to 50% of the risk of people who continue to smoke. 6. The risks of mouth, throat, esophagus, bladder, cervix, and pancreatic cancers also decrease. A more recent report endorses the findings of the 1990 study.
These all seem overwhelming. When and where can I get help?
Ask for help today. Ask your doctor or counselor about how they can help you quit smoking for good today. Ask about the medications and counseling they can offer you. For free help to quit smoking, call 1-800-QUIT-NOW, that is, 1-800-784-8669, or visit www.smokefree.gov.
So what do I do after I quit?
Don't let smoking hold you back anymore.